So welcome everyone, my name is Zoe, I'm Head of Services at the NCCPE, and thank you for joining us for this seminar. So for those of you less familiar with our work, the NCCPE, National Coordinating Centre for Public Engagement, exists to help universities embed high quality public and community engagement across their core mission. We support culture change, strategic development, effective partnership working through projects, services, and lots of other stuff that we do for universities in the sector. Today's seminar goes right to the heart of our mission. We're exploring social accountability and public value models in faculties and institutes, looking at how it shapes teaching, learning, placements and research. We have colleagues from St Mary's University and Cardiff Business School, and they're going to share what that looks like in practice. And this conversation today also aligns really closely with the work that we're undertaking in our Engage Futures programme, which we'll pop a link for in the chat. This programme is working with the sector to imagine what a more inclusive, sustainable and publicly engaged university system could look like by 2045 and the actions needed to get us there. It's already brought together hundreds of participants. It might be more than 1,000 now, I might have to check. Hundreds of participants to consider how universities remain relevant, trusted and connected in a changing landscape. And the examples we're going to hear about today are live case studies of the sorts of things we've been talking about in that space. We also need to acknowledge that we are meeting in a period of change. Universities are having challenging times, and there's also been lots of change in the research and funding landscape. There's a new CEO at UKRI, and UKRI are moving towards a strategic, outcome-focused funding approach, aligned with its mission to advance knowledge, improve lives and drive growth. Ian Chapman emphasised what is essentially a renewed social contract between universities, funders and society, that public investment must translate into clear public outcomes and that universities need clarity of purpose and strong partnerships to deliver them. This reinforces why models like the ones we're going to hear about today really matter. They offer structured, intentional ways of demonstrating relevance, value and accountability to the places, community and wider society. In this period of change, the NCCPE are committed to convening people together in ways like this to share practice and align our collective efforts. We have a big event coming up at the end of April that we'll pop a link for in chat, which aims to provide a rich opportunity to come together, share, learn and find out lots about what colleagues are doing across the sector to make a more engaged university system. And we hope to see lots of you there. The discussion today is particularly timely. We're going to hear about approaches to social accountability in medical education and public value-driven business education. We're going to speak to the sector's current challenges and opportunities about staying relevant, trusted and ensuring that new institutional structures serve the public in tangible ways. So if you haven't already introduced yourself, please do so in the chat. We've got a Q&A functionality too, so if as the speakers are talking, you've got some questions, you can pop them in there. And would really like to have as many questions as possible. So we're going to hear from three different speakers today from two different institutions. Our first is Sonia and Samira from St Mary's University Medical School. So we're going to hand over to Sonia and Samira and we're going to bring up their slides.
Thank you, Zoe. So I think there might be some animations here. So I need to take control because Samira, I can see your name's not come up. There we go. Yeah. So really, it's lovely to be here with everyone. My name's Sonia Kumar. I'm the Executive Dean of Medicine at St Mary's, a new school of medicine that's opening this September. And I'm joined today with Samira. Samira?
Hi, so my name is Samira. My background is community-led collaborations, and I've been working with Sonia and St Mary's School of Medicine around co-designing a socially accountable framework.
I just wanted to start off with this quote, and I think it's a really nice quote, and it's a quote that actually came from one of our community participants, which is, how we're preparing for the community and how the community is preparing with us. And I think hopefully that sense of reciprocity will come through as we go through the presentation. So just to give you, just to sort of guide you through the next 10 to 15 minutes, we're going to give you a bit of background about ourselves and our positionality in this work, our call to action, which is both local, national and global, how our health system and our health education system, and I hope that many of you here will be able to translate some of what we're saying into other educational disciplines, the great mismatch between our educational system and what we need and what we find out, the situation we find ourselves in. And then Samira is going to be talking about some really amazing work we've been doing, developing a social accountability framework for the new school. So in terms of myself, you know, I've been around many years in both education, but also in clinical medicine. I can see, I noticed a name on the chat, so hello to my colleague from Leeds. I was at Leeds for a couple of years where I set up Centre with a number of colleagues, which was a community engagement network. I set up a research collaborative at Imperial, which was around social impact. And so you can see through my journey, my commitment to community health and education has really rung true in everything that I've done. And to be able to bring that to a new school of medicine is, I think, a gift is an understatement. It really is a blessing. But I'm going to hand over to Samira to talk about herself.
Yeah, so I would say there's a list there just in terms of my work and having worked in healthcare, in community, in local government, in research, but essentially, I think if you ask anyone in the system, they go, "Oh, Samira, it's that person who's works in the community." And if you ask people in the community, they go, "Oh, Samira, it's that person who works, you know, in the NHS or in research or whatever." So for me, I'm the person who occupies the in-between space and actually kind of convenes people from different perspectives and different kind of disciplines to come together around connecting together and creating a shared purpose.
So I'm not going to list the things here. You will recognise many of the things, and of course some of those things are really more relevant than ever. But what this means is that the populations and the societies, both locally but also globally, that have the least experience the greatest inequalities when the system is under pressure. And what we're finding is, despite more and more money, this is now in the UK, being poured into our national health system, inequalities are widening. And they're widening, obviously, in areas of deprivation. I put this slide here because, being in the world of doctoring, us doctors often think that we have the answer to everything, and that actually we are the greatest determinant of health. But of course we know that not to be true. We know 90% of your health outcomes are not defined by your doctor. They are defined by all the other things that sit around you: where you live, where you went to school, how much money you have, your transport links, your access to healthcare. So the social determinants of health really underpin so much of what we do in social accountability. This translates globally to the SDGs, and the 17 SDGs, which are the UN's call to action that we can meet these SDGs, which is fast approaching in 2030, which cover many of the same areas, which again are housing, access to water, life on land, life underwater. Many of those again will resonate with you. Now, the reason I put this is that, being a new school of medicine in London, many people often think inequalities. Well, I just wanted to sort of just point out 2 points on this tube line, the central line. Many of you will recognise this. So Oxford Street enjoying a colossal life expectancy of 96. And if you go just a few stops down the tube line to Shepherd's Bush, White City, I don't know whether many of you know that area, it's where the Grenfell Tower is, you can see there's almost a 20-year life expectancy difference. And so you have to ask your question, what is going on? So the NHS recognises this, and the 10-year plan, which of course our NHS has come up with many plans, but this is one plan which really does, I think, it does really link to how many clinicians and community organisers and people around the country think, finally we have a plan that speaks to us. It has 3 pillars. It talks about analogue to digital, from diagnosis to prevention, but importantly you can see in the middle the biggest shift, which has been called the left shift, is hospital to community. Now the GMC, which is, I'm in the game of training doctors, the GMC sort of translates how we need to train the pipeline, because of course one of the healthcare professionals that will be serving our communities and delivering the 10-year plan are doctors. And they talk about the knowledge, skills and values. And I think the values and behaviours are probably the most interesting here. And what are the values and behaviours we need? Because the knowledge and the skills, they're changing rapidly, particularly with the advent of AI and access to information. But the knowledge and the values and behaviours, that is the bit that I'm not sure we always get right in medical education. So just to sort of list the sorts of things that we're trying to shift towards as we become a left shift medical school, is that the values, actually, we start to think about socially minded doctors who are committed to addressing inequalities. They're aware of their own limitations, they care for each other, but importantly, they care for themselves as well. So we find ourselves in a great mismatch. 90% of our outcomes are not determined by doctors, are delivered, I'm starting at the bottom, are determined by your social determinants of health. But we know that the fundamental basis of many medical schools is a biomedical scientific model. We know that we need more doctors to work in the community, particularly GPs. But we know that more than 75% of most traditional schools' clinical placements are in hospitals. And we know that 90% of care is delivered in the community. And that doesn't just include GPs, it's community pharmacy, community nursing, community midwifery. But we know that health spend is often focused in secondary and tertiary centres. So we need a fundamental change. And at that point, I'm going to hand over to Samira.
Yeah, so I suppose you can see lots of pictures here. And one of our aim was very much around, if we need a fundamental change, where do we start? And our starting point is conversations with people in communities who are actually at the receiving end of healthcare. So what is it that we need to do and how do we do it in such a way? So our starting point was very much around, if people are familiar with Theory U, it's about convening, it's about reflecting, it's about actually kind of thinking through with people in communities what it means and then working through. So we then went into thinking, well, what is the social accountability framework? So if we start from actually the kind of WHO definition of social accountability, it's very clear. It's about our obligation as medical schools to really kind of think about prioritizing the health concerns of our communities. So what does that mean? And how are we going to connect to people around this particular definition? So it was kind of very clear in terms of really thinking, well, what does that mean? Well, for us as a School of Medicine, our simple starting point is, what is it? What is the question that we need? So we didn't want to start by assuming we knew what the question is. So we started with really kind of doing some unlearning and some collective sense making and really kind of thinking about the question. So in the first phase of the conversation is social accountability. What does it mean? What is the question? And this is the question that emerged. As a person in community, when I or my loved ones are at most, we want a brilliant doctor. We want an amazing clinically trained doctor. But we also want somebody who understands me, knows about my culture, knows about where I live and how I live. So that's really kind of, so then that was our framing, if you like. That was our baseline for really beginning to think about how do we answer this question and how do we co-design a social accountability framework that works to this. So why does it matter? Why does it matter? Well, as Sonia said, really, the problem and the challenge is that health happens in community, treatment happens in clinics and in hospitals. So the problem and the challenge is that everything else happens outside healthcare setting, yet our training is very much focused on a clinical model of health. So then how do we train and enable people? What are the things that we need to have in place to really enable us to do that? Well, in a lot of the conversations, and this is kind of very much about if we are going to adopt the WHO definition, then what is it? What do we need to do and how do we need to do it? And what do we mean by social accountability? So then they said, well, it's not as simple about as training a doctor. There's kind of 4 key elements, if you like. It's about what it feels like. So from the end user's perspective and the lens through which we use it is very different from the lens through the community sees. So the person is, when I'm interacting, that's more a person-centered care. From a community perspective, it's a human-centered care because it's about the whole person within the community. From the student is, how do I feel confident and how do I actually work within? How am I trained to actually kind of support things? And then from an institution, do we really have the structure and infrastructure and the culture to enable us to do that? These are not kind of separate silos, but they're interconnected. But there's something about actually kind of underpinning those things. So any social accountability needs to take 4 things rather than just kind of single siloed approach of really thinking about a person. So then we really kind of think, so what is the underpinning? What underpins all of this work? Well, there are kind of 5 things that really kind of came out. One is humility. As doctors, we need to understand that we know some things, but we don't know everything. So the idea is about how do we listen, not only to respond, but to learn and unlearn and really kind of think about a knowledge that the person sitting in front of us. Then there's something about being curious. Don't assume you know, to ask the right questions, get to know your community, get to know the people. Then there's something about trust. Trust has to be both ways. If I trust you to give me advice, you need to trust me and listen to what I have to say. Emergence, working with people and communities is messy. Get involved in that messiness, kind of get engaged in that. Don't assume that actually, our systems tend to be very transactional. This is a very relational way. So how do we start with the conversations and actually kind of allow it to emerge into something else? And then dignity and pride. Communities who experience the huge health inequalities may live in areas of huge health inequalities, but they have phenomenal assets. So we really need to kind of think and use that as a way of really connecting. So what does that look like? So this is kind of our first step, if you like. Our approach to social accountability framework is not really, it's an approach, it's a way of connecting, it's a way of being. And it's really about actually kind of thinking about 3 elements. What is our social purpose? What actually kind of the curriculum looks like? How do we train students? And then what do we put in place to make sure that we hold ourselves and each other accountable for what we do? So for us, really, this is a very much kind of the start of an invitation to a different conversation and a different way of connecting. So we invite you to that conversation.
Thank you, Samira. Thank you, everyone, for listening.
Thank you, Sonia. Thank you, Samira. We'll just bring those slides down for a second. So it was great to hear about the social accountability model, and I've already got lots and lots of questions. Before we dive into some of those questions, we're going to hear from a different model. So we're going to hear from Peter. So Peter is at Cardiff Business School, and he's going to talk us through the public value model that they follow in their business school. So we're going to bring up Peter's slides. While we're getting that sorted, you can start to think of questions for Sonia and Samira, which we'll be doing after Peter's presentation with everyone together.
Well, thanks very much. Thanks, Sonia, Samira. Really interesting work that you're doing. And I would say, as an intro, you've been embedded in this for a long time, and I can see that engagement has structured your lives and your careers in lots of important ways. I'm a bit different. I'm pro-dean of public value. I look after that issue for the school, so to speak. But I've been in the school nearly 40 years. I haven't moved around. I specialised in the automotive industry. I'm an expert on sustainability in the industry and on socio-technical transitions. But I am also an illustration of the very ground-up development of public value within the business school. Having been there a long time, predating the emergence of this ethos, I contributed to it, as did so many of my colleagues. And I want to emphasize that because it's very important and distinctive that this was not purely a top-down imposed approach. So how am I going to make this move?
If you click take control, Peter, at the top again, and then it'll, there you go.
Okay. So, yeah, nearly 10 years, long time. And very much crowdsourced, but with massive support from the leadership, very keen on this. There hasn't been such a thing elsewhere. We predated the Future Generations of Wales Act here in Wales and the SDGs, and we created it for ourselves and of ourselves, so to speak. And over time, we've tried to grow it. So this is something I want to really explain in the context of this presentation. Started up within us, we've grown it, we've nurtured it, but now we face some really existential challenges, and that's kind of really what I wanted to focus on next. So our approach is very much like Sonia and Samira. We're outward looking, we're interested in collaboration. It's about being flexible and agile. It's about being connected with communities locally and internationally. It's about reaching out. And of course, Wales is one of the poorest regions in the United Kingdom. We have so many social, health, environmental problems. They're all accumulated around us. We feel our key mission is to do something about that, is to improve people's lives. And we do that not just through teaching and research. We really think that for authenticity, it's important that we also try to live that life ourselves and deliver in our day-to-day work. So we have these 5 so-called grand challenges. Again, these were the kind of outcome of the crowdsourcing of ideas. I'm not going to talk at great length about them. I'll just flash them through for you so you can see kind of what they're about. We have an idea of decent work, and I've expanded this idea of decent work again. You can just have a quick look. If you're interested in the slides and in more detail, please get in touch with me. I'm happy to send them back to you. But you can begin to see that when you start to unpack each of these grand challenges, there's a lot of individual detailed areas of work going on, all of which are contributing. So we have a school of nearly 300 academics. It's a big school, and there are lots of people doing lots of different sorts of work. One of the challenges is really to articulate all of that diversity of effort. Similarly with fair and sustainable economies, it's a big issue here in Wales. Wales is a country ravaged by industrialisation, so we have plenty of work to do in this area. Again, a long list of activities that we're engaged in one way or another: research projects, collaboration projects, community projects, writing, teaching. It's all part and parcel of our work. But we're also forward-looking. There's a lot of interest in alternative organisations, different to mainstream business. So people working on co-ops, on shared projects, on ways of collaborating and working together that transcend individual organisations. These are all innovations that we believe will help us deliver on public value. So there's lots of interest in things like organisational design, NGOs, B Corps, etc., etc. Again, lots of interest in this in terms of research and teaching, how we bring our students through, and our links to the wider community. And then perhaps because we have a big accounting and finance section, we kind of got interested in good governance. How do we look to ensure that the organisations we're working with and we ourselves have good governance structures that help us to prevent excesses, shall we say, of activity or power. And I think this idea of responsibility and transparency, which Sonia and Samira mentioned, also really important for us in this area of our work. So lots of activities going on in terms of good governance. We have some really strange things. We've got people who've set up an extinction and accounting research centre. You kind of think, what is that? But this is what Samira was talking about, the equality of emergence. When we created public value as our starting point ethos, we never had this notion of accounting for ecological diversity. Nobody had thought about it. But by creating this space, we have created the opportunity. And so many of our academics have seized that opportunity to take their work into areas where they really feel they can make an important contribution beyond the typical kind of narrow confines of a business school. And then finally, we have kind of responsible innovation. I'm an outlier here. My overall take on this is that innovation is largely speaking unsustainable. Not many of my colleagues agree, but there's a real interest, obviously, in the school, but in society at large. We have a sort of messianic faith in the power of innovation. I'm interested at least to see that innovation proceeds and unfolds in more sustainable and more democratic ways than we've experienced it to date. And a lot of colleagues are working in this kind of area. So we see there's interest in new technologies, obviously AI, biotechnologies, etc., but also in more kind of organizational social innovation, creating new practices, new behaviors in collaboration with the communities where we're working. So So that's our overall approach. We've tried to nurture this, and we've nurtured it in lots of different ways. So it's all about reinforcing and messaging. And in the past, that was much easier. So, for example, with recruitment, promotions, etc., we would always have public value as one of our criteria. So if somebody wants to come and join our school, one of the questions is, how does your work fit in with our public value ethos? And that's true with lots of other things. Any discretionary funding we've had, we've tied it to that public value ethos. When you apply for funding from us within the school, when a member of staff applies for funding, if they want to go on research leave, if they want to do a project, we always ask, what is the contribution to public value? And it's also been a key part of how we've been evaluated in the research excellence framework and so forth. We've done lots of things like business breakfast. I've got to be honest, I've only been to one. Breakfasts are too early for me. But yeah, lots of people go. It's really a good way of communicating with our local political leaders, with our local business leaders and so on. We've got whole new research groups, as mentioned. We've redesigned our courses, both wholesale, whole new courses, but also within existing courses, and we've even worried about our estate, and we've nurtured our own hedgehog population. This is all marvelous, but now the world has changed, and I think the reason for me coming today is really to ask for help, to be honest, about what we do about this changing world around us. Firstly, as we're all well aware, the institutional context for universities in the UK and more widely has shifted dramatically. And I think it's fair to say that that's been harder on Cardiff University than many others. We're also worried about political change. What happens if Reform win the next elections here in Wales? Will they abolish the Future Generation of Wales Act? We're really worried about the financial crisis. Our own university is in deep financial trouble, and there are consequences. We've lost people. We don't have the discretionary funding anymore. We're talking about flying faculty out to all sorts of corners of the world. There's huge changes going on throughout our institution. And within that, we want to try and hold and keep that public value ethos. We've worried about the name. Because maybe people think we're just for the public sector, and we're not. But we're also worrying about more fundamental things like, how can we measure what we're doing? How can we measure our contribution, our progress? How can we measure our value in a profound way? I've tried to illustrate very briefly what a diverse mix of things we have going on. We have some fabulous stories, some great narratives. We don't have clear measures of what we're trying to do. And we don't even know if the students know, let's be honest. We're trying to work on this. We're clear amongst ourselves, I think, within the school, the staff, the professional support teams. We all know what we're trying to do here. We're getting better at taking that message out to people like companies or funding organizations that want to help support our work. We're not very good at looking at how that impacts on our recruitment of students, and most importantly, once we've got those students, how we've managed to change their attitudes, their values, their beliefs in the time period that they've been with us, and then they go out into the world. Because in the end, that's the most important thing that we can do. If we can help create a new cohort of people with a broader sense of social mission, a sense of empathy, a sense of trying to create impact in their societies beyond simply making money, then that for us has to be progress. So I think we've not been good at that. That's partly my job, it's partly my fault, therefore. But I think you can see that we're trying to work down this particular route. So here's our main challenges. How can we keep it alive? I love that word immersion, Samira, and we're very immersion. It's almost like difficult to keep a lid on, but how can we keep that going in the context that we're currently in? I'm really reluctant at first even to write down grand challenges or to write down subsets of work. It's really risky because it can become fixed, and I want to avoid becoming a doctrine. And then what do we do with all the managers around us who don't understand it, who don't care, who think about different metrics, who are worried about their QS rankings, etc., where our work doesn't fit? How can we reconcile that? And I'm particularly keen about trying to find a way, an alternative way of presenting ourselves to the world that gets away from these data companies like QS, who, without any invitation from us, rank us and rate us in all sorts of ways that we have no control over. So I think we have many, many challenges. On the plus side, there's so much energy and enthusiasm. We hope and believe that whatever comes out of all of this restructuring and change, we'll still have that public value ethos and we'll still be able to do good work. Thank you.
Thank you, Peter. It's great to hear more about your work, and I feel very humbled by the sorts of things you were talking about and the challenges that you're currently facing. We're just going to take the slides down, and then we're going to bring Sonia and Samira back onto Spotlight. And I've definitely got some questions lined up for everybody, but if you have any questions as well, I just echo what Madeline's just popped in the chat as well. Refreshingly and marvellously honest and personal. I would totally agree with that as well, and I'm very grateful for everyone's honesty, because this stuff is hard. Like, it is hard to go against institutional norms, rankings and all of that, and taking all of that into account. So I guess my first kind of question, and we can have a moment of thinking time, is obviously we have a really challenging landscape in funding, student numbers and all of that sort of stuff. But within these models, there's a bit of an opportunity. So my question is, what opportunities do these approaches open up for your institutions that if they didn't follow them, they'd be missing out on? You can have a moment to think, or if anybody wants to jump in and answer, go for it.
Well, I can dive in on behalf of the school here. I mean, we feel quite strongly that public value has given us a truly distinctive voice. There is no other business school anywhere that does this. Many institutions follow the SDGs in various ways. We have our own. It's very much nurtured by us. And we think, in consequence, that actually the students coming through, particularly throughout the courses that we've changed around public value, are benefiting in many ways. They understand the world in more complex ways. They understand the importance of ensuring the social viability of organizations as well as their financial viability. And I think it helps us work with the community in ways that we never used to do. So in all those ways, I believe it helps.
Thanks, Peter. And it definitely, as Paul's popped in the chat as well, what Peter was talking about was, it does echo UKRI's new kind of rhetoric that they're using, advancing knowledge, improving lives, those sorts of things. Sonia or Samira, you're obviously at a very different point in the journey to Peter. What kind of things do you think it'll open up for St Mary's?
I start, Samira, and then you can, or do you want to? I'll start. Yeah. So, I mean, I think, totally agree, Peter, what you said. I think, all the stakeholders, everyone around that pentagram benefits from this sort of work. Health partners, us, our students, local council, everyone that we're working with benefits from this sort of work. But I went to a conference yesterday on redefining meaning, and it's really got me thinking about how for some universities this is an add-on, for other universities this is embedded into their sort of social mission. And I suppose the very thing that possibly could save a university or save us as individuals as we start to lose our way as professional services or academic staff is actually our meaning and our purpose in our work. And I think particularly for our students, I'm just thinking, I've got two kids who are both at university. This stuff's really important to them. Climate, political activism, social activism. They really care about this stuff. But yet when they go to university, no one talks about it. There's no opportunities to do good on their course or to give something back. But they're a generation that want this, that they're seeking it. And that's not surprisingly why a lot of our students, they don't turn up, they're a bit disillusioned. Staff are a little bit disillusioned. Everyone's talking about financial crisis. And amongst all of that, we've kind of lost our meaning. And I do think this work can sit at the centre of that and sort of reignite the reason why we entered academia and the reason why our students come to university. But Samira, you'll have other thoughts.
So I suppose for me there is something about, I suppose, I mean, developing something that's actually quite emergent is quite, I mean, it rubs against the system, and it can actually kind of create a lot of tension, and you know, the old system will always bite back. But then for me, then how do we actually kind of work and connect differently with people and communities so that it becomes their university? They are as invested in this as the institutions themselves. And I think there's something about the frustration and how we actually kind of hone in on the frustration to really help us connect and develop. I think sometimes we downplay the value and the assets of people and communities in what they bring around actually mobilizing and developing change. So I think the fact that there is pushback means that we are actually kind of doing something that's different, something that's emergent, something that's complex, that actually kind of challenges the existing status quo. So there's something in that, as frustrating as it is, the problem and the challenge is that we're not going to be able to continue, certainly from a health perspective. The health system is not going to be able to carry on doing what it does while our health inequalities are still widening. So the case for really kind of doing something different, the case for social accountability is really spot on at the moment, because we know and understand, you know, there was the Health Foundation actually kind of put, you know, the health in 2040, the Marmot keeps, you know, we have the Michael Marmot, you know, 2010, 2020, and I think there's a launch tomorrow in Kent about the new Marmots. So there is a real issue and a challenge. It's just then how do we actually use that to keep us honed in on purpose and on connecting differently with students and communities.
Thank you, Samira. Peter, I don't know if you want to respond to anything Sonia or Samira have said, or...
No, I'm happy to keep the debate, you know, coming in from the outside as well.
Yeah, lovely. So one thing that Peter alluded to, and that we have a lot of interest in the NCCPE, and maybe this is part of the jigsaw that helps us unlock how to talk about this sort of work, is how we measure how effective it is. And I know, Peter, you reflected on, like, you're not very good at doing that sort of work. So I just wondered, Sonia, Samira, have you thought about how you've done it? Or Peter, do you want to share about how you've tried to do it? And we can have a bit of a reflection on that, and then we'll come to a question in the chat.
Well,
Peter, you don't want to go first?
Go on, Peter.
Yeah, you don't want to see a grown man cry.
Oh no.
Yeah, it's been interesting. I mean, we've had it from the accreditation agencies, you know, saying, "Oh, lovely stories." Same with the research excellence framework. You know, we did really well last time round on the public value was right in the middle of our submission. We scored maximum on our research environment. The impact cases scored really highly, but you know, we're talking to one of the accreditation bodies, and they wanted kind of 5 years of measures showing how we've delivered on public value. And then I'm struggling. I mean, I can measure quite a lot of inputs, and I've supported a given number of engagement fellowships over the years. We've had a given number of business breakfasts and so on. We can measure those inputs.
Yeah.
What I can't yet get a handle on is how can we show the impact, the outputs, if you like, from what we've done. And so, for example, you know, we've had a project in the south, what we call the southern arc of Cardiff. And southern arc is a bit like you were saying, Sonia, with the tube line map. You know, southern arc of Cardiff has much lower life expectancy than the north part of Cardiff. So we've got some projects going on in there, and they're great. They're about inclusion. They're about trying to get some of those younger generations into our university or somewhere else. We know that graduates who live there with kind of foreign sounding names don't get jobs quite as easily. We know that these things go on. We're trying to do things about it, but we don't know, are we having an impact? And that's where the challenge is for me.
Yeah, so understanding things that you can measure that might indicate that there has been a change. And some of these things are really complex. They have lots of different things that affect them. So how do you pick apart that, like, chain of events? Definitely. Samira, Sonia, any ideas?
Well, I can see an old colleague that you'll know as well, Samira Bjorg. Hi, Bjorg. She's written something, as always, very wise in the chat. When I was at Imperial and we set up Medic, it was a centre centred around social impact. So we sort of had to think about this, and we did have some pyramids. So for Students will use Kirkpatrick's hierarchy to sort of think, okay, well, what are we measuring? Are we measuring attitudinal change or knowledge change, or are we trying to get to that really thorny bit, which is actually right up at the top? Are we changing values and behaviours, which actually maps really nicely to the GMC outcomes? We never got to values and behaviours, but for students it was far easier to measure. We did focus groups, questionnaires. We were noticing, and our research did show, that the more sort of social impact work that they were doing, things like community action projects and such, it was having an impact. So that was great. The bit that was really hard, the bit we never really got to, was patients and communities. So, you know, you can do things like, well, A&E attendances, or do they either go to their GP more because their access is better, or do they go less because actually they're able to look after themselves, or does that mean is access poor? You never quite know what's the story behind the numbers. And then I guess you can look at sort of more biomedical outcomes. You know, if students are attached to patients with diabetes, actually, do their diabetes markers actually get better? So, you know, there are different ways, different levels. I guess I always see things in pyramids and systems, you know, that there are different levels that you can try and address this. But I have to admit, again, just being very transparent, the bit that we never really got at were how can we show true impact on patients and communities? And I think that's probably a brilliant segue, Samira, to you giving us a solution.
Well, I can't give you a solution. What I can give you probably is that the challenge is actually the tools that we use, and the tools that we use for evaluating and measuring impact, and to what extent they are fit for purpose for what we're trying to do. So one of the things, I mean, the same challenge was around, I kind of developed the Community Champions program in North West London, and one of the things was, how do you measure impact? And I'm glad someone put in the social impact evaluation. The idea is, how do you use, one is, how do you begin to use different tools for different things? And the second, there is something about two things. There is the evidence-based practice. So we look at tools for measuring impact, and then there's something about generating evidence. So practice-based evidence. So how do we, as we develop the thing, I think one of the things in the conversations that we had as an outcome in itself is trust. Trust is an outcome in itself. And what does trust mean? And how do we measure trust? It's about being trustworthy. It's saying and doing what you commit to do. And that's how you measure it. So the idea is not about actually thinking that trust takes we know and understand that trust takes a long time. And people don't differentiate between the university or academia or research. To them, it's all one and the same thing. How do we become trustworthy to actually kind of do and connect differently? So one of the things we were looking at was very much around actually kind of the community itself is the school. So the idea is, how do you put students in placements in community settings, and how do you actually create parity of esteem between placements in community settings as well as clinical settings? Because then that gives you something different, and that gives the impact and actually kind of generates trust as you go along. So it's almost kind of an enabler and an outcome in itself. But I think for me, having worked in health inequalities area and in the EBI agenda and working with communities, you're always looking for alternative measures of impact and evaluation tools, because the current evaluation tools are only fit for certain things, for already established methods.
Thank you, Samira, really insightful. And this is the sort of thing that we think about a lot at the NCCPE as well. And one of the projects that me and my colleague Gemma worked on last year was the National Civic Impact Accelerator. And Gemma's been working on something called a Civic Outcomes Framework, which we rapidly put on the website this morning, just in case we thought it would be useful to share today. It's still in draft version, it's not completed, but it kind of touches on some of the things that you've all just talked about, and it's looking at how we can use indicators, or we can follow through logic chains, so using a theory of change approach to look at the different sorts of civic impacts a university might have. But it is a really, really tricky thing to think about, definitely. So we've got one question in the chat in the Q&A that we'll come to from Stuart. So this one's for Peter. So how do you view frameworks like EPSRC's responsible research and innovation, given that your view that innovation is not sustainable? A nice easy one.
Yeah, nice, easy. Yeah. Thing is, I don't think their funding model is sustainable or responsible, which makes it very difficult. Um, you know, they're asking academics primarily, but also other organizations, to invest a huge amount of time, effort, and money, resource, into processes with, at best, 2 or 3% people getting funding. I don't think that's responsible. I don't think that's a decent way to work. It's not a decent way to treat people. So I find it hard to relate to that sort of statement when they can't seem to manage it themselves. And you have to go one layer below and ask yourself, well, you know, responsible for whom and for whose interest? And again, the direction of travel for a long time now has been towards more utilitarian work, something which is more focused on the interest of business very narrowly, and generally speaking, takes away a direction of travel from where we are trying to go. So I think it's problematic. To be honest, I think we get a lot of our funding, which is actually more tied to kind of social missions and so on, doesn't come from the likes of the UKRI. It comes from business organisations and foundations and people like that. So this very sort of mechanistic view of funding, I think it has been problematic for a long time to come. And I don't believe that they have responsible research and innovation. I just don't believe it.
Thank you, Peter. Very candid.
I would say I don't speak on behalf of the university or the school in this sense, but I think there is a real undercurrent of disquiet about this. I mean, I've stopped reviewing for the SRC because I don't think it's reasonable.
Thank you. Samira, Sonia, what do you think of that kind of like responsible research and innovation idea?
I mean, I think at the moment, as you can tell, we're sort of nascent and we're birthing. So, you know, what will sit under our framework will be various strands, and one will be sort of our educational offer and looking at reciprocal benefit, and one of them will be research. I mean, I don't think I've got really much to add to what Peter said. I just don't think we're in that world at the moment. Yeah. But of course we will be careering into it. So Samira, I don't know whether you've got anything to add, but I could give you some waffle, but I'm not going to.
No.
Thank you. We've got a comment from Paul in the chat as well, just bringing things back to the new UKRI CEO, speaking at a recent conference, and they said, we are spending public money and we are here to service the public. We don't talk about that enough. It's their money we are spending, and we are here to get an outcome for them. And we need to get much better at helping people not see outcomes, but feel outcomes. And Paul's reflected that it would be really interesting to look at both of your different projects through that lens to show how they realise outcomes which really do impact on people's lives. And I think maybe this is part of the challenge or part of the ways of tackling the challenge, Peter, of the kind of maintaining the work that you're doing, being able to speak directly to that remit coming out of UKRI. And I didn't know if either of you had any reflections on that.
Yeah, well, as you probably gathered by now, I'm not a big fan, but I think, again, this very instrumentalist approach is talking about spending public money, blah, blah, blah. Yeah, fine. But the amount of public money that comes to us as a social sciences research end of the spectrum is maybe different in medicine, but it's tiny, a tiny fraction of the total spend that goes on, and so we get crumbs from the rich man's table, and then we get this edict that says we have to spend that money wisely for the public. I don't think they're doing a very good job themselves, and then when it comes down to the fundamentals of what universities are about, I think it's really dangerous, risky. And here it comes back to the innovation piece, to tie to short-term outcomes. Universities used to be the place where people did blue sky research, open-ended research, without necessarily an immediate and practical outcome, a measurable set of targets. And what comes after that, of course, is properly innovation. It's really something that it's the sort of thing that gave us lasers in the past. nobody had a use for them. They do now, and that happens in the social sciences as well. So I think we're by being so instrumentalist, we're actually reducing the capability of universities to generate the foundations of innovation, and we're just becoming more like development tools. And I think that's a mistake.
Thank you, Peter. Interesting reflection, definitely. We've got some comments in the chat just around some ideas or examples of how measurement of these sorts of things has happened for other people. One from Bjorg, which was at the Training for Health Equity Network. We conducted an impact study. They demonstrated a more positive impact in the communities served by socially accountable graduates than conventional graduates. And they said that it's important to identify the specific competencies that you want your graduates to have and identify how and who should assess them. And Sophie's just popped in as well, the use of outcome mapping and doing that collaboratively, and that can bring out how different partners make sense of what you're doing together and enables you to develop that shared approach and shared purpose. And it can also help decide if a partnership isn't quite right for you currently. And Bjorg's popped some good links in the chat as well, which is really, really helpful. I think we'll end on a slightly lighter question, is what sorts of things on the ground does this sort of approach look like in practice? So some tangible examples of the sorts of things that a socially accountable medical school might do, or how you might demonstrate that public value, Peter. Any sort of nice tangible examples?
I can give you one that kind of bridges a bit. So one of the things that we do is I used to have, it shrunk, I had a fund to support what we called public value engagement fellowships. We've given them a small amount of money, £5,000, some time, so take some time out of their workload, and a year, and they would pitch a project and off they go. So one of them, a couple of years back, was from one of our professors of marketing, Luigi. And it's basically a project where he was going to cut across the different university schools and put together a team who could help develop a set of facilities for disabled youngsters. Brilliant idea, but couldn't get the other people across the other schools to contribute because no other school in the university had a similar sort of fund or similar sort of approach, so nobody could get the time. So Luigi then went off, worked exclusively on his own with the charity that was concerned, developed a whole new marketing campaign for them, particularly really redefine their kind of internet marketing, their use of digital tools and so on, help them accumulate a huge amount of money. And they're now building a whole new centre just on the Wales-England border. It's going to be a fabulous facility. He's still working with them 2 or 3 years on. I've been involved a bit, others have been involved. So we've contributed to somebody's journey. We're going to see real impacts in terms of these children's lives. It's a fabulous project, and only because he was interested. It's not, he's not going to get anywhere in marketing by doing this job, but he wanted to do it, and he put so much time and effort into it, and now we see some results. It's just fabulous.
Thanks, Peter. That's a really lovely example. And it just shows how long it takes to kind of build these relationships, all of the little bits and pieces of work that you have to do along the way to get to a point where you can undertake that quite large project. Samira, Sonia, I know you're at a different stage, but maybe it's a bit of an imagining example.
Well, not really, Zoe, because our students start in 6 months, which sort of excites me and terrifies me at the same time. I've got some examples, and Samira, you can pitch in maybe with some of them as well. So I guess whenever I think of, social accountability, and this will come out as our framework sort of develops, sort of thinking about, the student journey. So how are we recruiting our students? We've just, in fact, today I'm making decisions on the final offers, which is very exciting. But we've got 10 social impact champions. So we didn't offer scholarships on the basis of academic expertise. It was on the basis of commitment to their social accountability. So that's, one example. In the curriculum, student placements, all placements have been mapped to indices of deprivation. So students, as you know, medical students, they have to be placed out. The majority of their final 3 years are always that they're placed out, but we've mapped these to areas of deprivation, and we've been really challenged ourselves because you know, the people that have come forward to teach us aren't in areas of deprivation. So we're now proactively going out to areas in southwest London that we know actually are those areas. In year one, students are doing music therapy as a clinical placement, which is sort of quite innovative. In year three, students will be doing a faith and health project. So as part of a clinical placement, they'll be doing a quality improvement study in a faith setting. Projects will be marked and they'll be assessed, and they'll be part of their assessment portfolio. And the last thing is to ensure, just going back to sort of Samira's pyramid, where at the bottom you've got accountability and governance, we've got a patient and public committee, which is part of our governance structure, to ensure that this isn't one-hit wonder stuff, that we are ensuring we remain accountable and that their voices are part of, an equal part of, our governance structure. Those are just things I've just literally flew off the top of my head, but Samira, I don't know whether you want to add to any of those.
I suppose there is the celebration event on the 29th of April. The idea is to actually kind of really connect with local people and communities, and actually kind of to invite them to be part of this journey. And one of the things we want to do is at every step. So just in actually kind of developing the first draft of the social accountability, we want to invite them to actually kind of celebrate with us, but also to kind of help us then define what that looks like. So and the excitement in communities about actually doing this so differently, it has been just kind of phenomenal in terms of their level of engagement. So there is kind of an element of celebrating, even though we're still at the very early stages of celebrating with people and actually kind of taking them on that journey with us.
Thank you, Samira. Lots of exciting things coming up. And we're just about at the end. There is a question in chat that we've not had time to answer. So I don't know if Sonia, Samira, Peter, as we wrap up, you want to pop an answer to that. But the question was, oh, can I find it now? From a student education perspective, is there anything that you've considered in student assessment for community engaged learning? So around how you assess that community engaged learning. And I know that's something we've been thinking about as well. And Sophie's popped some comments in chat from the NCCPE about that too. But we are just about finished now. So thank you, Peter, Samira, Sonia, for talking today. I've really enjoyed hearing more about it. And from our point of view, this is the beginning of a conversation. We really see a lot of potential in these models, and it's definitely something we want to continue talking about. So thank you, everyone, for joining us today. And we've heard lots of different ideas, approaches, and hopefully what we've been able to convey is just how important these sorts of models are and how impactful they can be, not just for curriculum design, but for partnerships, placements, research agendas, for the whole institution's identity and how it interacts with its place. As the sector continues to navigate funding challenges, shifting expectations and questions about its social contract, the discussion today has shown that there are lots of different ways that we can kind of get around this and that we can collectively learn a great deal from. If you found today inspiring and you want to come to more opportunities like this, then please do come to more of our online events. And we do have the summit coming up in April. We're just going to pop a couple of links in chat. So one of them is our feedback form for this event. So please do fill that feedback form in. And also we've just popped some links in for the Engage Futures programme and the seminar, which is coming up, and another Civic University Network event, which is coming up in a couple of weeks. So thank you, everyone. Thank you to our speakers, and have a lovely rest of your Thursday.
Thank you.
Bye.